Hi, this is Marty Stempniak, staff writer for Hospitals and Health Networks. I'm coming to you from the International Hospital Federation's World Congress here in Chicago, and I'm joined today by Rich Umbdenstock, the now past president and CEO of the American Hospital Association. Rich, thanks so much for being with me today.
My pleasure, Marty. Thank you.
Now, your retirement is just in its infancy now, but just how does it feel to be closing this chapter of your career?
Well, it feels really good. It's been 42 years since I got out of graduate school, been in healthcare the whole time, have seen a lot of very positive change over that time. But it's also a period where, with an upcoming presidential election and other major issues on the table, it's a good time for a change of leadership. So I feel good about the transition that's been made, and I feel great in the first month of reduced responsibility.
Mm-hmm. As I said, we're at the IHF right now. There's a number of healthcare conferences going on in Chicago this month, but what makes this one different? What makes this one special?
Well, the world is in Chicago. 47 nations, about 700 attendees, just going to be a terrific conference. I've had the pleasure of going to these every 2 years over the course of my AHA presidency. Always learn a lot. We're all different, but we're all dealing with exactly the same issues, starting from different places and certainly having different levels of resources or experience, but you can learn a lot from the international community. So I really look forward to these sessions.
Mm-hmm. Your colleagues from other nations have been using ICD-10 for a number of years, but us in the U.S., we're just getting started last week. So what are the early reports? How are things going out in the field?
Well, it sounds like the start on October the 1st and since then has gone well, but we know that the real proof of the pudding, so to speak, will come down the road as people are filing their claims and so on. What's really different when you think about ICD-10 here in the U.S. context is that, yes, other nations have already been using it. As a matter of fact, I was in Israel a couple of years ago, and they were talking about the movement to 11. The difference is we use it for payment. And that's very different. No other country does that, is my understanding. And so it means a whole lot more to us. And it's not just a categorization and data gathering function, it's a payment function.
Mm-hmm. And I understand you're moderating a session later this week. What's going to be the topic of conversation? What are you guys talking about? We're
going to talk about the large-scale improvement efforts that have been underway and continue to be underway, like the HEN project, the great work that's been done around central line infections and early elective deliveries. We'll have Malik Joshi from the Trust. We'll have partners from out in the field who will talk about how they've done it in their organizations. I think that's something where we really have something to share with the rest of the world. It'll be interesting to hear their feedback on how they're addressing the very same in-hospital or hospital-associated conditions.
Mm-hmm. Great. Just any parting words for your hospital colleagues? Any things you'd like to say as your parting ways?
Yeah, certainly. Well, first of all, I think that, as I said just a second ago, the progress on performance improvement is enormous. And I like to say, as an advocate for hospitals, that that's our best offense. We're really doing the right things for patients. We're improving care. We're dropping costs. We're on the right side of the issue. And I know the field wants to get even better, even faster. That's terrific. The second thing is that right now we have another opportunity. The annual rate of increase in healthcare spending is at an all-time low, something I've never seen before. We have to keep it there as best as we possibly can and not give that advantage up. Keeping costs down is our best defense. And we have to play both offense and defense in the public policy sphere if we're going to be successful. So my message to my colleagues is you've done terrific work on the quality side, great work on the cost side. I know they're going to keep pushing on the quality side. We really have to keep costs low.
Great. Thanks so much for being with me today, Rich.
My pleasure. Thank you.
For H&HN, this has been Marty Stempniak. Thanks for watching.